Hi, this is Simon King, and this is a quick introduction to Afferentology for health professionals. At a very basic level, life is all about outputs. Outputs which we recognize as growth or repair, movement, homeostasis, and to do that work requires inputs in the form of energy and nutrition and oxygen and sunlight. And the maintenance of those inputs creates health. We know that health is enough of what is essential, like not having any deficiencies, and not too much of what is harmful, so no toxicities. Because really, deficiencies and toxicities are the only true cause of disease. We get deficiency like scurvy and toxicity like cyanide or lead. When we think about deficiency and toxicity, we usually think about diets and medications, chemicals, or even emotions, but we almost never think about nerve messages. So we have these cells in our body, like blood and liver and kidney and nerves, and they all require inputs, oxygen, proteins, sugars, and these inputs produce outputs, like bile and proteins and urine. But nerve cells are special because nerve cells also require stimulation, which is an electrical input from which they produce nerve messages. Now, where do these nerve cells get their stimulation? Well, it turns out one of the main sources of stimulation are muscle spindle cells, which continuously produce an output which becomes an afferent input into the central nervous system. And from this input, then the nervous system processes that input and then produces output in the form of muscle contraction, and this is efferents. The combination of these two ingredients creates muscle control, because the brain will give us an idea about what it wants to happen, but the localized control is down to these reflexes, mainly the myotatic reflex. Now, the spindle cell output depends on the tension on the muscle. The more tension, whether it's passive or active, you get more output from the muscle spindle cells. When you get more input from the spindle cells, you'll get more output from the muscle itself, and this is the basis of the myotatic reflex, which you can see in the knee-jerk reflex. Now, if you get the afferent input confused in any way, you can get an increased input, which we would call a toxicity of input, or a deficiency of input, which is what you might get with inhibition of a muscle. Now, how might that be caused? Well, you've got the withdrawal reflex as one cause, because muscles are not only controlled by your brain. Inputs from the skin can also change muscle tone, so our skin is so sensitive we can feel one hair move. It doesn't take much to cause the contraction of some muscles and the inhibition of others. This is the classic nail in the foot. You step on the nail and it activates some muscles and inhibits the antagonist to those muscles. What has this got to do with your patients, though? Your patients don't have a nail in their foot, or do they? So you can see toxic inputs are everywhere. Now, you can't know whether a foreign body is causing a bad input if you don't test for it. And remember, the withdrawal reflex doesn't have to be a reaction to pain. Tickling also initiates a withdrawal reflex, facilitating some muscles and inhibiting others. Any irritation to the skin can induce the withdrawal reaction, even if there's no visible movement. It might just make some muscles tight and others weak. The only way to return those muscles to normal is to get rid of the irritation. And it doesn't matter how well trained you are, how often you go to the gym, how many stretches you do, whether you do Pilates or yoga. Reflexes are always stronger than exercise. So just try holding your hand against a hot iron. You can prove it for yourself. So health professionals trained in afferentology know how to find muscle inhibition and remove the bad inputs which cause it. They restore normal neuromuscular tone to make their patients stronger and more robust. This prevents injury, relieves pain, improves posture, increases flexibility, and even prolongs life, because we know that the weaker patients are, the earlier they die and the more disease they suffer. Afferentology is very effective at treating symptoms, but it's really good at restoring health and creating robustness. You can get onto our free course in Afferentology right now at afferentology.org. And if you enjoy what you find there, we'd really love to see you along at one of our live workshops.